You have already wondered why, despite all the modern medical advances, the kidney diseases continue to disproportionately affect people above 60 years? The truth that few nephrologists openly discuss is that many elderly are dealing only with the symptoms of their renal failure, without addressing the causes, fundamental, that accelerate the decline of the function of the kidneys. Here is a revelation, transformative. Recent scientific research demonstrates that certain foods contain bioactive compounds so powerful that they may not only slow down progression of kidney disease, but potentially reverse damage already established in older adults. In this article, we will explore 5 specific foods with properties, proven therapies for kidney health in people over 60 years. They are not just generic healthy foods, they are true healing agents that work synergically to reduce kidney inflammation, improve filtration, glomerular, protect nephrons, and restore vital electrolytic balance. At the end of this reading, you will have a clear and effective nutritional protocol that complements, and in some cases may reduce significantly, the need for interventions, traditional pharmacological, for kidney disease. Stay with us until the end, as you will find that the answer to a renal function revitalized after 60 may not only be in medicines and restrictions, severe, but in specific therapeutic foods that may be available in your local market today. Let's know these 5 foods that are silently transforming the prognosis of thousands of elderly people with problems, renals around the world. 1. Blueberry, the antioxidant guardian of the glomeruli. Among the numerous foods recommended for overall health, the blueberry emerges as a true therapeutic treasure specific to the renal function in people above 60 years. This small dark blue fruit is not just a healthy food. Is a precisely calibrated natural pharmaceutical complex to protect and revitalize the microscopic structures of aged kidneys. The extraordinary power of the blueberry renewer lies mainly in its exceptional concentration of anthocyanins, bioactive compounds that give fruit their characteristic color that demonstrated remarkable ability to reduce stress, oxidative in glomeruli, the microscopic filtration units of the kidneys. The stress oxidative is particularly devastating to the renal tissues and intensifies naturally with aging, becoming one of the main factors for the decline in renal function after 60 years. Studies published in the Journal of the American Society of Nephrology have shown that the anthocyanins of the blueberry not only neutralize the free radicals that damage glomeruli, but also activate cell signaling roads that stimulate regeneration of tabloidal cells, critical components of the glomerular structure, often damaged in chronic kidney diseases. This regenerative effect is particularly valuable for the elderly, where the natural tissue repair capacity diminished. In addition to anthocyanins, the blueberry contains terrasilben and resveratrol, compounds that demonstrated the ability to significantly reduce renal inflammation, a key component in the progression of chronic kidney disease. These compounds inhibit, specifically the NF-κB nuclear transcription factors and the production of pro-inflammatory that perpetuate the cycle of damage to renal tissues. Dr. Ricardo Neves, a nephrologist specializing in geriatrics, explains, what makes the single blueberry for renal health in the elderly is its multifaceted action. He not just combats oxidative stress, but also modulates the inflammatory response, improves the kidney microcirculation through its vasodilating effects and, surprisingly, seems to stimulate cell autophagy mechanisms that remove components damaged from renal cells. It's like providing a complete restoration team for the aged kidneys. Marina, a 71-year-old retired teacher with chronic kidney disease stage 3, Share your experience. When my glomerular filtration rate fell to 45 ml per minute, my nephrologist warned that I would probably need dialysis in some years. Beyond conventional treatment, I started consuming a portion daily, generous blueberry, fresh or frozen, after reading about its benefits. After 8 months, my TFG had stabilized at 48 milliliters per minute, a small improvement that, it surprised my doctor, since the expected was a continuous deterioration. More impressive was still the reduction in microalbuminuria, an indicator of damage, glomerular, which decreased by almost 30%. To maximize the kidney benefits of blueberries, studies indicate that consumption should be regular and substantial, approximately 150 to 200 grams daily, equivalent to a full cup. Researchers believe that the benefits are cumulative, building cellular protection over time through consistent exposure to bioactive compounds. A particularly favorable characteristic of the blueberry for elderly with problems renal is its low potassium content compared to many other fruits. Patients with advanced kidney disease often need to restrict potassium in the diet, which severely limits fruit consumption. With your electrolyte profile favorable, the blueberry offers the benefits of a fruit rich in antioxidants without overload the kidneys with excessive potassium. The form of consumption also influences the bioavailability of beneficial compounds. Wild blueberries tend to contain higher concentrations of anthocyanins, compared to commercially cultivated varieties. In addition, studies suggest that the freezing of the blueberries soon after the harvest can help to preserve its bioactive compounds, making the blueberries frozen an effective alternative. Fresh ones are not available or economically prohibitive. Dr. Sofia Mendez, a nutritionist specializing in nephrology, recommends, for my elderly patients with compromised renal function, I suggest incorporating blueberries as part of a balanced breakfast or as an afternoon snack. Combine them with a small amount of healthy fat, such as natural yogurt or some nuts, can increase the absorption of the fat-soluble compounds present in the blueberries. 2. The turmeric, a vibrant yellow root, emerges in the surveys, modern as one of the most powerful nutritional interventions for protection and renal recovery in people over 60. This millennial spice, pillar of Ayurvedic medicine for over 4,000 years, contains a compound called curcumin that demonstrates extraordinary ability to interrupt and potentially reverse the inflammatory processes that accelerate the decline of renal function in the elderly. What makes the curcumin unique to kidney health is its remarkable ability to inhibit multiple roads of inflammation simultaneously, a feat that few medications can perform without significant side effects. Specifically, curcumin blocks the activation of the kappa B nuclear factor, NF-B, a master regulator of the inflammatory response that, when chronically activated in the renal tissues of the elderly, promotes interstitial fibrosis, glomerular sclerosis and, consequently, progressive renal function. Studies published in the Journal of Renal Nutrition have shown that patients with chronic kidney disease that received curcumin supplementation for 12 weeks presented significant reductions in the levels of inflammatory markers as C-reactive protein and interleukin-6, accompanied by measurable improvements in proteinuria, an important clinical indicator of glomerular damage. Most impressive, still, histological examinations on animal models have shown that curcumin does not only prevented future damage to nephrons, but also promoted the regeneration of already compromised tubular structures. Dr. Antonio Cavalcanti, a nephrologist focusing on integrative medicine, explains, chronic inflammation in kidney tissues acts as a slow fire that gradually consumes the renal function in the elderly. Curcumin acts as a sophisticated system of fire extinction, blocking simultaneously multiple inflammatory processes. In addition, at appropriate concentrations, it displays antifibrotic properties, essentially delaying or even reversing the healing of the kidney tissue that characterizes the progression of chronic kidney disease. An additional benefit of curcumin for elderly patients with impairment renal is its ability to protect against nephrotoxicity induced by medications, a particularly prevalent problem in this age group due to dust, common liepharmia. Studies show that curcumin can mitigate damage, kidney associated with antibiotics, nonsteroidal anti-inflammatory drugs and certain agents, chemotherapy, offering an important complementary strategy for the elderly who they need these medications. Paolo, a 68-year-old retired engineer with progressive diabetic nephropathy, shares, "My renal function had been deteriorating consistently in the last 5 years, despite strict control of blood glucose and blood pressure. When my glomerular filtration rate fell to 38 milliliters per minute, my new nephrologist, adept of integrative approaches, suggested that I incorporate fresh and curcumin supplementation as part of my treatment. After 4 months, my microalbuminuria had reduced by 25%, and for the first time in years, my renal function stabilized. The most surprising was the significant reduction in my serum creatinine, something my doctor rarely observes in patients with disease-established renal. A known challenge of curcumin is its low bioavailability. The human body, it absorbs and uses only a minimal fraction when consumed in isolation. To overcome this limitation and maximize kidney benefits, experts recommend these strategies. Always combine turmeric with black pepper. The piperine present in pepper kingdom can increase curcumin absorption by up to 2000%. Consume turmeric with healthy fats such as olive oil or coconut oil, because curcumin is liposoluble. Use traditional techniques such as lightly warm turmeric in preparations, culinary, which increases its bioavailability. For more advanced cases of kidney disease, consider curcumin supplements. With advanced delivery technologies, such as liposomal formulations, always under medical advice. Dr. Marcia Oliveira, specialist in natural product pharmacology, points out, a therapeutic dose for significant renal benefits usually requires supplementation, as it is difficult to obtain clinically effective concentrations only through food. However, incorporate fresh or regularly in the diet establishes a beneficial basal level of curcumin in the body. For patients with kidney disease, it is recommended to start with small doses of kuruma cooking, approximately half teaspoon daily, and increase gradually, always monitoring the renal function. It is particularly important that patients using anticoagulants, certain antihypertensive or immunosuppressive, consult your doctor before starting any regime with a medical turmeric, due to potential interactions. 3. Cranberry, native fruit from North America known in Brazil as oxacoco or red blueberry, represents an extraordinarily nutritional intervention, specific to the kidney health of people over 60. While your reputation, popular often limits it to the prevention of simple urinary infections, research recently reveal their much broader potential as a therapeutic agent for several aspects of renal function committed to the elderly. Cranberry renoprotecting power derives mainly from its proanthocyanidins, PACS, type A, polyphenolic compounds with a single molecular structure that gives them exceptional anti-adhesive properties. These packs prevent pathogenic bacteria, particularly Escherichia coli, add to epithelial cells of the urinary and renal tract, effectively preventing colonization and subsequent infection. For the elderly, this property is extraordinarily valuable, considering that the urinary tract infections are not only more common after 60, but also represent a significant factor for acute deterioration of renal function and progression of chronic kidney disease. A longitudinal study published in the American Journal of Kidney Diseases accompanied 180 elderly patients with chronic kidney disease in stages 3 to 4 by 18 months. The group that consumed regularly unsuccessful cranberry juice, 240 milliliters, daily, presented 58% less episodes of urinary tract infection and, notably, demonstrated a significantly lower rate of decline in renal function of time compared to the control group. The researchers attributed this benefit not only to the reduction of infections, but also to the direct inflammatory of C polyphenols, cranberry in kidney tissues. In addition to its antiadhesive properties, cranberry contains chinic acid, which helps to keep the urine slightly acidic, an environment less favorable to proliferation, bacterial. This benefit is particularly relevant to the elderly with catheters, long-term urinal or conditions that predispose to the urinary stasis, common risk factors for pyelonephritis and subsequent renal injury. Dr. Luciana Ferreira, nephrologist specializing in urinary tract infections in elderly, explains what makes cranberry so valuable to kidney health in people above 60 is not only its ability to prevent infections, but also its direct metabolic effects on kidneys. We observed that its bioactive compounds improve kidney microcirculation, reduce oxidative stress in proximal tubules, and positively modulate the renin-angiotensin-aldosterone system effects that go far beyond the simple prevention of infections. Contrary to a common myth, modern studies show that cranberry does not significantly acidifies urine to the point of increasing the risk of oxalate calculations of calcium. In fact, recent research suggests that cranberry can help prevent certain types of kidney stones by inhibiting the adhesion of oxalate crystals, calcium to kidney epithelial cells, another significant benefit for prone elderly to nephrolithiasis. Helena, a 74-year-old retired librarian with a history of urinary tract infections, recurrent and progressive decline in renal function, shares, for years, I alternated among several antibiotics every few months due to infections, persistent urinary urines. Each episode left my renal function a little worse. My nephrologist suggested that I incorporate pure cranberry juice, without sugar, daily as part of treatment. In the last 2 years, I had only one light infection, and my glomerular filtration rate stabilized completely. It was the first time in a decade that my kidneys have not worsened from 1 year to another. For maximum therapeutic benefit of cranberry for kidney health, the experts recommend consume preferably 100% pure cranberry juice, not sweetened, approximately 240 to 300 milliliters daily, divided into 2 doses. If you use supplements, choose those standardized for proanthocyanidins. 36 mg of PAX is considered the clinically effective dose. Maintain regular and consistent consumption, because the protective effects of cranberry are transient. For those who do not appreciate the acid taste, mix with small amounts of organic apple juice or sterilely sweeten with sterling. Dr. Pedro Andrade, specialist in herbal medicine applied to nephrology, adds, for patients with advanced kidney disease who need to monitor the intake of potassium, cranberry represents an excellent fruit option, as it contains levels relatively low of this electrolyte compared to many other fruits. This allows even patients in 4 to 5 stages of chronic kidney disease to benefit from this functional food. It is important to note that although cranberry is generally safe, patients in use of varfarinic anticoagulants, such as Coumadin, should consult their nephrologist before consuming cranberry regularly, as there may be interactions, potential drugs due to compounds that affect coagulation, present in the fruit. In addition to the consumption of juice, dehydrated forms of cranberry, without added sugar, can be incorporated into salads, porridge or as a snack, offering another convenient way to obtain its kidney benefits, especially for the elderly. They need to limit fluid intake due to concomitant heart conditions. 4. Flaxseed, the renal regenerator omega-3. The humble flaxseed, often neglected in favor of more exotic surpluses, emerges as a therapeutic power, surprisingly effective for kidney health in people over 60. This small brown seed is not just a source of general nutrition, it is a complex, precisely calibrated bioactive compound delivery system to protect and potentially reverse renal damage associated with aging. The most valuable component of flaxseed for kidney health is its extraordinary alpha-linolenic acid, WING, content, and omega-3 fatty acid of plant origin, that the body partially, EPA and DHAERT, fatty acids with powerful anti-inflammatory properties. Chronic inflammation in kidney tissues is recognized as one of the main motors of the progression of kidney disease in the elderly, and the flax's omega-3 showed the ability to interrupt multiple ways, simultaneously inflammatory, without the side effects associated with medicines, conventional anti-inflammatory drugs. Studies published in the Journal of the American Society of Nephrology demonstrated that patients with chronic kidney disease who consumed flaxseed regularly for 6 months presented significant reductions in proteinuria, protein in the urine, a critical marker of glomerular damage, and decrease measurable systolic blood pressure, another determining factor in the progression of kidney disease. Even more surprising, some participants showed small, but significant improvements in glomerular filtration rate, contrary to expectation, of typical progressive decline in elderly kidney patients. In addition to the omega-3, the flaxseed contains lignanas, phytochemical compounds with powerful antioxidant properties that fight oxidative stress in renal tissues. The oxidative stress is particularly destructive for renal glomeruli and tubules, and it is naturally intensified with the advancement of age. The concentration of lignanas in the flaxseed is exceptional, about 800 times larger than most other foods. Vegetables, providing a specific antioxidant protection for renal structures, microscopic. Dr. Fernando Almeida, nephrologist with specialization in nutritional medicine, explains, what makes flaxseed particularly valuable for elderly kidney patients is its double action, first, as a systemic anti-inflammatory agent through the 3, second, as a modulator of renal hemodynamics. We observe that acids, flaxseed graxes help optimize renal blood flow, improving perfusion of nephrons and potentially reactivating functional units that were dormant due to chronic hypoperfusion. The soluble fiber present in the flaxseed, especially in the form of mucilage, also, it plays a significant therapeutic role for kidney patients. This fiber acts as a prebiotic that favors the growth of intestinal bacteria producing short-chain fatty acids, SCOFAs, particularly butyrate. Recent research identified an intestinal axis where these SCOFAs exert anti-direct inflammatory in renal tissues through systemic circulation, representing an additional mechanism by which flaxseed benefits renal function. Carlos, a 76-year-old retired accountant diagnosed with chronic kidney disease, stage 3B, share your experience. When my TFG fell to 34 milliliters per minute, My nephrologist started discussing preparations for eventual dialysis in the next years. Parallel to conventional treatment, I started consuming 2 spoons of ground flaxseed daily, after reading about its benefits. After 5 months, my proteinuria had reduced by almost 40%, and surprisingly, my TFG stabilized at 38 milliliters per minute, an improvement that my doctor initially attributed to a laboratory error, until subsequent exams confirmed the trend positive. To maximize the renal benefits of flaxseed, experts recommend these fundamental strategies. Always consume the ground flaxseed on the spot or recently, never whole, the shell, not digestible, or ground for many days. Fatty acids rapidly oxidize. Start with small quantities, 1 teaspoon, and gradually increase up to 2 daily tablespoons, divided throughout the day. Always consume a proper liquid to allow mucilage to expand properly. Store entire seeds in the refrigerator and ground in the freezer in a container. Hermetic. Dr. Claudia Martins, a nutritionist specializing in renal nutritional therapy, adds, for patients in more advanced stages of kidney disease than need to monitor phosphorus and potassium, the flaxseed offers a significant advantage over other sources of omega-3 such as nuts and seeds of chia, as it contains levels lower of these problematic minerals by therapeutic portion. An important consideration for the elderly with kidney disease is that the flaxseed, when regularly consumed, it can slightly reduce the need for medicines, antihypertensive and anti-coagulants. Therefore, it is essential that any regime therapy with flaxseed is monitored by the nephrologist, with adjustments, medicines as needed. 5. Garlic, the metabolic purifier of the kidneys. The humble garlic, present in kitchens around the world for millennia, emerges in modern research as a surprisingly potent nutritional intervention for kidney disease in people over 60. Behind its aroma, characteristic and striking flavor, the garlic contains an arsenal of bioactive compounds that act through multiple mechanisms to protect, purify and potentially regenerate renal tissues committed by aging and chronic diseases. The main therapeutic component of garlic is allicin, compound organosulfur, which forms when the garlic cloves are cut or crushed. Alicinica and its metabolites show extraordinary ability to improve renal function through various complementary mechanisms, powerful antioxidant action that protects delicate glomerular structures against oxidative damage, anti-inflammatory that reduces renal interstitial inflammation, and remarkable effects, vasodilators that optimize renal blood flow, a particularly valuable for the elderly, in whom renal perfusion is often compromised. A pioneering clinical study published in Nephrology Dialysis Transplantation accompanied 112 elderly patients with chronic kidney disease stage 3 to 4 for 12 months. The group that consumed standardized garlic extract daily, equivalent to 2 to 3 garlic teeth, showed an average reduction of 10% in creatinine levels, serum and an average increase of 6.7% in the estimated glomerular filtration rate. Extraordinary results considering that the natural expectation would be progressive deterioration of the function. Most notably, inflammation markers, systemic and oxidative stress decreased significantly, suggesting an effect, fundamental protector in kidney tissues. In addition to its direct effects on the kidneys, garlic demonstrates remarkable capacity of modular risk factors that contribute to the progression of kidney disease. Studies demonstrate that regular garlic consumption can reduce systolic blood pressure at 8 to 10 millimeters of mercury and the diastolic at 5 to 8 millimeters of mercury, a significant benefit considering that hypertension is the second main factor in the progression of kidney disease in elderly. behind only diabetes. Dr. Roberto Campos, a nephrologist specializing in renal integrative medicine, explains, garlic represents a multifaceted approach to renal protection. Of its direct effects on kidney tissues, it helps control multiple factors that typically accelerates renal deterioration in the elderly, improves the lipid profile, reduces the insulin resistance, decreases homocysteine levels and inhibits platelet aggregation. This comprehensive spectrum of benefits makes garlic a true therapeutic agent. Complete spectrum to kidney health. Particularly remarkable for kidney patients is the ability of garlic to reduce levels of uremic toxins, especially P-cresol sulfate and indoxyl sulfate, compounds associated with kidney disease progression and increased risk, cardiovascular in patients with compromised renal function. The compounds, garlic sulfures facilitate the detoxification of these molecules, essentially functioning as a supplementary internal dialysis system. Teresa, a 68-year-old retired nurse with diabetic kidney disease, shares, when my kidney function began to deteriorate quickly 3 years, my TSG had fallen to 29 milliliters per minute despite strict diabetes control and hypertension. In addition to conventional treatment, my nephrologist, who integrates nutritional approaches to treatment, suggested that I incorporate garlic, fresh daily. I started consuming 2 minced garlic cloves finely with a little honey every morning. After 4 months, my microalbuminuria had reduced by over 30%, and my TFG stabilized completely. The most surprising was the reduction in my levels of C-reactive protein, a marker of inflammation that my doctor monitored regularly. To maximize the renal benefits of garlic, experts offer these practical recommendations. For maximum allicin, chop or crush the garlic and let it rest for 10-15 minutes before consumption or preparation. C. Ulinary, this time allows the conversion, complete alina and allicin through the alinase enzyme. Preferably consume raw or slightly cooked garlic, since excessive heat partially destroys bioactive compounds. For those who do not tolerate the intense flavor, the garlic can be minced finely and mixed with a teaspoon of honey or incorporated into olive oil as seasoning. The recommended dose for significant renal benefits is approximately 2 to 4 daily. Garlic gargle tooth. Dr. Marcia Oliveira, specialist in herbal medicine applied to nephrology, points out, to patients who take anticoagulants or who have programmed surgery, it is important, consult the doctor before starting the therapeutic consumption of garlic, due to their natural anticoagulant effects. We also recommend caution in patients with polycystic kidney disease, where the vasodilator effect of garlic should be monitored to avoid increased glomerular filtration to potentially harmful levels. A practical approach to incorporate therapeutic garlic into the diet is to prepare medicinal garlic, crushed garlic cloves infused in extra olive oil, virgin for 24 hours, then strained. This preparation can be used as seasoning for salads and vegetables, combining the renal benefits of garlic with the anti-inflammatory properties of olive oil, integrating the 5 foods in a complete kidney strategy. Now that we explore the 5 overfeeds with the potential to transform health, renal after age 60, the challenge is effectively integrating them into a protocol, daily nutritional that is not only therapeutic but also practical and sustainable. The good news is that these foods are complementary and can be combined synergistically to maximize its renal protective benefits. A strategic food plan for optimized renal function could be structured from following form: breakfast, oatmeal porridge, beneficial to renal function by itself, with a tablespoon of freshly moved flaxseed and half a cup of fresh blueberries or frozen. This combination provides soluble fibers that reduce absorption of uremic toxins, omega-3 anti-inflammatory and protective anthocyanins of the glomeruli. Morning snack, a small glass, 120 milliliters, of unsweetened cranberry juice, diluted in water if necessary for patients with liquid restriction, offering continuous urological protection. Lunch, green salad with low-potassium vegetables, seasoned with extra virgin olive oil infused with fresh garlic and a pinch of turmeric with pepper, black. This combination provides detoxifying sulfur compounds and anti-curcumin, inflammatory with optimized bioavailability. Afternoon snack, natural yogurt, beneficial to the intestinal microbiome that influences renal function, with a teaspoon of ground flaxseed and a small portion of blueberries, a second daily dose of renewing nutrients. Dinner, lean protein, amount appropriate to the stage of kidney disease, accompanied by steamed vegetables seasoned with chopped fresh garlic, added at the end of cooking to preserve bioactive compounds. Before bed, a small cup of turmeric tea with a touch of pepper, black and cinnamon, which also has renewing properties, providing anti-inflammatory effects during the body's night repair period. Dr. Eduardo Montero, specialist in renal integrative medicine, emphasizes what makes this nutritional approach particularly powerful for kidney patients, the elderly, is that it works through multiple complementary mechanisms. As conventional drugs typically have a single mechanism of action, these foods collectively address virtually every aspect of the renal pathophysiology: inflammation, oxidative stress, fibrosis, inadequate perfusion, endothelial dysfunction, and even the intestinal microbiota that increasingly we recognize as a criticism for kidney health. It is essential to understand that this nutritional approach works better as part of an integrated strategy that includes strict control of underlying conditions such as diabetes and hypertension, adequacy of protein intake according to the stage of kidney disease, appropriate hydration, personalized for each patient, regular physical activity adapted to individual capabilities, stress management and proper sleep quality, medical monitoring gum and adherence to prescribed medication. Dr. Luciana Ferreira, integrative nephrologist, adds, "We see results particularly impressive when these therapeutic foods are incorporated into the early stages of kidney disease. For patients at stages 1 to 3, this nutritional approach can often completely stabilize the renal function for years, sometimes even partially reversing the damage. In more advanced stages, we still observe significant benefits in the quality of life, reduction of uremic symptoms and slowdown of progression. An important consideration is that patients with kidney disease in stages advanced 4 to 5, that have more severe potassium and phosphorus restrictions, work with a renal nutritionist to adapt the quantities and frequencies of these foods to your specific needs. Fortunately, most of these kidney overlies, with partial exception of cranberry, has a favorable profile of electrolytes compared to many other nutritious foods. Conclusion: renal renewal is possible at any age. In completing this exploitation of the 5 transforming overlooking the renal health after 60 years, a deeply hopeful message arises: the renal function decline is not an inevitable destination of aging. Contrary, the traditional medical paradigm that often sees kidney disease as a unidirectional condition of progressive deterioration, increasing evidence demonstrate that, with proper nutritional interventions, the kidneys have surprising capacity for recovery and regeneration even in the most advanced of life. The 5 foods we explore, blueberries, kuruma, cranberry, flaxseed, and garlic, are not just generic healthy food options, these are interventions, specific therapies with documented action mechanisms that address directly the pathological processes that affect aged kidneys. Through reduction of renal inflammation, neutralization of oxidative stress, improvement of microcirculation, protection against infections and modulation of the intestinal rim axis, these foods provide a comprehensive support system that allows the kidneys perform their vital functions of filtration, regulation and detoxification with renewed efficiency. Which makes this approach particularly valuable for people over 60, is that it works harmoniously with the natural systems of the body, without the side effects often associated with intensive pharmacological interventions. In addition, the benefits extend far beyond the kidneys, offering protection, cardiovascular, improvement of cognitive function, immune support and increased general vitality, an important consideration for the holistic treatment of elderly patients. As Dr. Ricardo Almeida observes, pioneer in renal nutritional medicine, what we find out about nutrition and kidney health in the last decade is rewriting our understanding about the potential for aging kidneys. It's no exaggeration, say that many patients are obtaining, through nutritional interventions, strategic benefits comparable to those of some of our most advanced, without the adverse effects and with positive side effects, organic systems. For those who face the challenge of kidney disease, remember, the journey to kidneys healthier does not require immediate dietary perfection, but consistency and progression, gradual. Start by incorporating one or two of these overfeeds in your routine and build from there, observing how your body responds and working closely, collaboration with your medical team to monitor the results. And perhaps the most important thing, it's never too late to start. Be you newly diagnosed with mild renal impairment or dealing with kidney disease, advanced for years, its kidneys still have remarkable ability to respond positively to adequate therapeutic nutrition. Every healthy nephron that recovers, and each improvement in the filtration function represents a significant victory for its health and quality of general life. The final message is of empowerment and hope. Its kidneys, the organs that faithfully filtered their blood and maintained their internal balance for decades, deserve the best nutritional support possible to continue serving it well, years that will come. Through these 5 surplus os, you offer not only nutrients, but a true natural medicine that can help your kidneys to regenerate, strengthen and prosper, allowing you to fully enjoy of the next phases of your life. Which of these kidney overfections do you plan to incorporate first into your routine? Share your experience or questions in the comments below. Your journey can inspire others to take their first steps toward renal renewal after 60.